We get in our cars, we turn on the ignition, we go. We don't even think about the barrier of transportation because we're able to drive. I didn't realize how critical it was.
HealthTran is a program administered by the Missouri Rural Health Association that provides coordination between healthcare providers and volunteer drivers to provide patients with transportation to the care they need.
The pilot project was a brainchild of Suzanne Aliewine and Doris Beckman, who are co-owners of Community Asset Builders in Jefferson City. Suzanne was the president of Missouri Rural Health Association, and Doris was the president of the Missouri Public Transportation Association. In 2013, Missouri Foundation for Health was awarding a grant in the amount of $497,000. And so Community Asset Builders wrote for that grant and received the award. And so HealthTran was born with that money. The goal of the grant was first to determine, was there a real barrier of transportation in rural Missouri? And if we provided transportation to patients, would they come? There were a lot of missed appointments due to lack of transportation. A lot of the riders had a pay source, Medicare, Medicaid, private insurance, Medicare with a supplement. They just simply had no way to get there.
It became obvious that in the rural counties that we served, there wasn't enough public transit to complete the need of what the medical providers needed. And we finally just said, hey, ask every patient who comes to the desk, do you need a ride? And when they started doing that, we really started doing a lot of rides and helping a lot of people.
We provide transportation for people who were early 20s, elderly, up into their 80s, maybe 90. Maybe they were born with a disability and they can't drive. Maybe they've had an accident and no longer can drive. Maybe they have seizures, could never drive, this type of thing. We did a lot of rides for mental health patients. Without treatment, they're not going to recover enough to be able to drive. We have a population in our area of elderly widows, and their culture was the husband drove. They never did drive. Or we did have the truck driver who called me for a ride, and he had a wound on the foot. And he said, I need to go to wound care. The doctor has prohibited me from driving, so I can't legally drive. I've crisscrossed this country for years and driven thousands of miles. And I'm sitting 5 miles from my doctor, and I can't get there without HealthTran. So it was a mixed bag. We implemented the rides in the fall of 2014, and they ran through June of 2016. We covered 9 counties in the beginning, and then we added 2 more counties by the time we had ended the grant. During the pilot, we received 4,725 referrals. The grant was implemented to be medical only and public transit only. We have areas in these 11 counties that there was no public transportation route whatsoever. So we knew to go into sustainability, we had to address transportation for those people in those areas. We needed to come up with a volunteer driver program.
Judy Shanley with National Center for Mobility Management and Easter Seals reached out to me and said, we have a design challenge grant. It was only $25,000, but the whole goal of the design challenge was to create sustainability. So within the second year of the grant, we started looking at how could this program be sustainable instead of, as in most grants, you get your money, you spend your money, and you're gone. But we didn't want to do that. That's what happens to rural people all the time. They get a grant and then they're gone. And that's when we really started building the HealthTran program and how that went forward.
If a healthcare provider identifies a need for transportation in addition to or in place of public transportation, they can apply to become a member. HealthTran members cover the expense of transportation for patients that need it, increasing revenue and improving sustainability.
It started off with the relationships that the Missouri Rural Health Association and Community Asset Builders had with federally qualified healthcare centers.
It all kind of starts with a conversation, and the HealthTran staff and whoever contacted us from whatever organization they're from will usually have a very brief info meeting, kind of stating who we are and what we do, and kind of trying to figure out if a partnership would work for them.
Some of our health providers do dental, mental health, physical health. Some of them have opened it up completely. They do kids' physicals for school. So, depending on the health provider and what they choose, because it's their program as well, they set their boundaries and what they feel like they can do. We're there to support the health provider because the health provider is paying for it.
So we are a member-based program basically, and it started as local transits and moved on to volunteer drivers, but we partner with these organizations to help fill the gap so people can actually get to and from medical appointments, because a lot of these people can't make it to appointments and have to cancel because of lack of transportation, because they're outside of limits of the local transit companies.
They need to have a driver's license for at least 3 years. They have to pass a background check and a 11-panel drug test, and those are both done annually. They must have a smartphone and internet access, must have a clean, reliable car, insurance that's up to date. And then the whole process usually takes about 2 weeks to get a driver from initial interest to actually driving for us.
You're pretty independent. You have a facilitator which places in the rides into the app for you, and you decide what you want to do and how much. Been doing it 5 days a week ever since I've been doing it.
And the HealthTran platform is wonderful. It is so easy to use.
It provides a lot of data collection, and that data is immediately provided to our health providers, so they have access to reports. How many are male? How many are female? How many do I have this month? What's the distance? What is my cost? How many are disabled? How many are veterans? And so they can immediately pull that data out and utilize it. Our assisted rides program also has heat mapping, and we can show that to them. I put in the percentages of the destinations and the distances. They put in their percentage of cancellations and no-shows, and it actually formulates and tells them if they could reduce that number by 50%, how much more income that they would generate. You're still paying lights, you're still paying staff, but you don't have anybody coming in the door. So it's been very enlightening and really exciting for them to see how they could turn that around. Where are your customers coming from, and where are the volunteers coming from? And we can target where we need to recruit volunteers at.
The volunteer drivers can go in and see what rides are pending, and then they can accept those rides.
I like the way that this system works because you can choose the rides you want to do. You can work as much as you want to or as little as you want to.
They love it, and the riders love it, and the health provider loves it. So, it's such a win-win for everybody.
And it's anywhere from 2 miles to like 200 miles. I mean, we have some drivers that do huge, long distance rides.
My furthest so far has been Columbia, which is about a 3-hour drive from here. All my pickups are like in the local area here, St. Joseph and Northwest Missouri, but they have me going all over the place. I just came back from Kansas City today.
I've had several new patients on HealthTran that just had to give up driving. And that's hard for a person, to say, hey, I can't drive anymore. And now they're wondering, what do I do? How do I get to all my appointments? And so that's where we come along and help them out, give them rides.
I love it, though. I enjoy it. I really do. If you're a person that's into serving others, this is a great way to do it if you've got the time and the ability and the means. People are really grateful for the rides. The rides don't cost them anything. They really appreciate you coming out to get them.
I think it is a great program. And we've worked very hard to get to this point. At the end of the day, you have been able to do something or be involved in helping do something for someone that really mattered, that made a difference for their life.
We've never wanted to be the only transportation provider. Our agenda is to improve the health of rural Missourians. The development of HealthTran is really starting to expand, but our niche is really that connection between healthcare providers and the community. And then hopefully, as we have enough staff, is where we can start pulling in more of the community to have more and more discussions and be those leaders.
As of early 2024, HealthTran serves about 1,700 rural clients across almost 45 counties in Missouri.
As we've tried to train mobility managers to have those community discussions. We've seen a lot of movement across the state in a lot of areas.
It's not like we're providing rides over to the golf course. We're providing rides to the doctor. Necessary rides, critical rides.
I think health providers have realized that access to their appointments has become a bigger and bigger issue. And with some knowledge and resources, they're understanding that providing transportation, paying for transportation, is not a loss, it's a win. People are starting to understand that the access issue is more than just somebody else not being able to get to where they go. It really is a much bigger community-wide, statewide issue.
We found that transportation is very expensive. It's very needed. The return on investment for medical facilities is good, but it's a new concept, and new concepts are not always easily accepted. So yes, it's had its challenges. We've gone 2 feet forward and 3 feet back, but we were determined. So it has been a long haul, but it's been worth every minute.